Worried that you or your child have an external ear infection? This is called otitis externa, and this is where the external auditory canal becomes infected. It can be a fungus, a virus, or a bacteria. Oftentimes, it happens due to the ear canal being moist or exposed to bacteria for a certain amount of time. On exam, you'll often find that the ear canal is swollen. There might be some serous or clear yellowish discharge. There might be redness to the ear canal. It might be very painful to touch or pull on the ear. With these types of ear infections, you're going to need topical antibiotic drops, or there might be other causes, like if it's a fungal cause, there might be a need for an antifungal. There are cases where the ear canal can become so swollen and shut that there might be a loss of hearing. And in order to get the topical antibiotic drops or treatment down, an ear wick will be placed within the ear canal. And once you put those drops on that wick, it will swell and hold the antibiotic closer to that skin so the infection can resolve sooner. If you or your child is prone to these types of ear infections, it's very important to keep your ear canal dry after getting wet. So once you get out of the shower or bath, you can take a hair dryer on the low heat setting and just very gently, dry your ear. Also, whenever you get out of a pool, say for example, they have an ear drying aid, they're drops that you can place into the ear canal that will help dry the ear. Do not put these drops in the ear if there is an actual infection going on, which brings me to my next point. If you have an ear infection, like an external ear infection, please don't put anything in your ear. I will see patients in clinic that have actually done quite a bit of damage by trying to place hydrogen peroxide or olive oil in their ear, and it's just made the infection or the pain worse. For the pain with this type of ear infection, you can take ibuprofen or Tylenol. I recommend ibuprofen because this type of infection is definitely due to inflammation, and ibuprofen will take down the inflammation. Ibuprofen is not appropriate for all patients, and especially children under the age of 6 months. So if you feel that you might have this type of ear infection, I recommend getting seen by a medical provider, and I hope that you feel better soon.